Welcome back to Good Day Dayton. I put a lot of importance on raising awareness about skin cancer, especially as we get into the summer months. And I'd love to hear from your perspective. Just give me the context here so we understand what we're talking about. What is skin cancer? Specifically, what is melanoma?
Sure. Well, as you mentioned, this is the perfect time of year to be talking about this. Melanoma is a cancer of the pigment-producing cells of the skin. And it's probably the most well-known skin cancer because of how severe it can be if it spreads throughout the body. So 40% of melanomas arise within pre-existing moles, and the other 60% come up just on normal skin as a new black dot that can grow over time. Initially, melanoma grows within the skin, but it can very quickly spread to lymph nodes and other parts of the body if not detected early.
If I'm hearing you right, it's something that's serious and should be treated seriously.
Certainly. The earlier we catch melanomas, the better in terms of prognosis for treatment. In fact, if we catch them in the earliest stage, there's a 99% cure rate with appropriate treatment.
There are things to look for. We have a graphic on screen right now. What it can look like, can you describe what we're looking at here?
Right, so this is a melanoma from a patient at our clinic. And really, dermatologists have developed a guide for what to look for. And we call them the A, B, C, D, E criteria. So asymmetry within a mole, irregular borders, colors that vary within the same lesion, a diameter that's greater than the size of a pencil eraser, and the E is for evolving, so any mole that is changing over time, whether growing in size or changing in color. Those can be warning signs and are worth mentioning to your dermatologist if you notice anything.
And of course, there are those non-melanoma skin cancers that exist. Are they less serious? I mean, do we need to worry about all skin cancer, generally speaking?
I think all skin cancer has risks that come with it. The other types of skin cancer, the most common is basal cell skin cancer, followed by squamous cell skin cancer, and melanoma is third. Basal cell and squamous cell skin cancers tend to be a local issue within the skin, but it can still cause severe problems because it can grow over time and invade into important structures. And if left untreated for many years, certainly can spread as well. So I think all of them are important and should be treated in a timely manner.
Anybody can get skin cancer or melanoma. If you have dark skin like I do, you can still get it. If you have light skin, you can still get it. What are some of the prevention ideas that you recommend, ways to avoid or at least limit our chances of getting skin cancers?
Well, that's a very good point. People often think if they've got a tan or darker skin that they may not be at risk, but really anyone can be at risk for skin cancer. In terms of risk factors, sun exposure is the main thing. And not just intense sunburns, which certainly you want to take steps to avoid, but also chronic sun exposure over the course of a lifetime. Our Dayton Skincare website, you can get more information, but also I work with a nonprofit that provides free skin cancer treatment for underserved patients. And so the website for that is itasc.org.